Iranian women who defy the country's mandatory hijab laws will now be given treatment at a specialized mental health clinic in Tehran. The opening of what they call a hijab removal treatment clinic was announced this week by Mary Talebi Derestani, the head of the Women and Family Department for the Department of Promotion of Virtue and Prevention of Vice. She said the clinic will be for scientific and psychological treatment, and that the project is focused on promoting dignity, modesty, and chastity. Participation in these clinics, Derestani claims, will be voluntary. Programs in the clinic will include educational courses led by experts on the philosophy and values of the hijab, and will offer individual counseling, group sessions, and skill-building workshops focused on reinforcing personal identity and skills for coping with social pressures. They will also provide guidance to help women confidently embrace modest clothing and reinforce their identity. This announcement comes days after a university student who stripped in apparent protest at harsh treatment by dress code enforcers was detained and sent for mental health treatment. Human rights groups including Amnesty International say there is evidence of torture, violence, and forced medication being used on protesters and political dissidents deemed mentally unstable by the authorities and placed in state-run psychiatric services. Iranian women and human rights groups have expressed outrage at the announcement and say this is part of the Iranian government's ongoing efforts to quash the powerful women's rights movement against compulsory veiling that intensified following the death of Mahsa Amini while in custody of morality police and the subsequent woman life freedom uprising.